the other thing I'd like to talk to you about the relationship of breast cancer and HRT. It's something that lots and lots of women talk to me about, and rightly so. But there's still an awful lot of rubbish, for want of a better word, out there. And I spend my life giving women, HRT that's safe. Is breast okay? Is body identical HRT? It is okay for you to take. So could you talk a little bit more about that for us?
Very, very important point. So HRT, breast cancer, still remains the one subject that puts off many women from HRT. Similarly, health professionals still hesitate when it comes to breast cancer and HRT, which you rightly pointed out should not be the case now, but we have a long way to go before everyone listens to the same argument. So for women who have not had past breast cancer, HRT appears to have very little effect on the breast. So when we say they take estrogen-only HRT if they've had a hysterectomy, from randomized trial data, it's clear that estrogen on its own does not increase the risk. And if you combine it with the progesterone, of course, any form of progestogen rather than progesterone, there's a very small increased risk after 5 years or 10 years, something to the tune of 1 or 5 in 1,000. That's less than most of the lifestyle issues like drinking or smoking or obesity,
Absolutely.
which is much higher risk.
Absolutely.
So we know that that's the case. In fact, as you pointed out, if you then take body identical HRT like the natural progesterone or the body similar dydrogesterone, you can even reduce that 1 in 1,000 risk to potentially close to 0, because the body identical hormones for the first 5 years don't seem to increase the risk. And even after 5 years, the risk may be less than 5 in 1,000 per 1,000 women. And so the risks are so tiny that for most women, the benefits from HRT, the quality of life, the benefits for cognitive symptom, the heart and the bones will far, far outweigh that small increased risk of cancer.
And as you mentioned, the bones and the heart are going to be protected for all the associated morbidities and diabetes as well, of course, which we haven't mentioned. And we've talked about breast cancer, and we know that women who have breast cancer are significantly overweight are far more at risk of having a breast cancer. Sorry, women who are overweight who have a far greater risk of having a breast cancer than taking HRT. And if you drink more than 2 units of alcohol a day. So I think that we've got to try and get that message out. It's still out there. I still see referral letters, I'm sure you do, saying this lady's mother had a breast cancer. I am unsure what to prescribe for her. I think hopefully doing these podcasts, we're going to enable people to really believe and get right. So thank you for joining me today, and I look forward to our next meeting. Take care.
Thank you so much, Joanne. Thank you.
Bye.
Take care. Bye-bye.